I want to talk a little bit about some of the most vulnerable Canadians that are getting hit the hardest, and that is not surprisingly seniors' homes across the country now, dealing with outbreaks in various provinces, some of them more tragic and more severe depending on where you are. And certainly that is the case at Ontario's Pinecrest Nursing Home in Bobcaygeon. It is a huge concern right now. The 65-bed home has one of the deadliest outbreaks in the country. They are up to, I believe, 13 deaths, 12 residents and a volunteer. And Dr. Stephen Oldridge is an attending physician there, and he joins us now from Bobcaygeon. Doctor, thank you for making the time. I do appreciate it, sir.
Sure. Good morning.
So maybe just tell me what is the latest on the situation at the Pinecrest Nursing Home from what you know?
Well, we're going to be giving daily updates. The medical director will be at 4 o'clock. We've been getting hourly updates on deaths, but we're going to release just the numbers once daily. This is a devastating illness. I can't describe just how quickly these people become sick. I think the message that needs to get out is there is no vaccine. We have no effective treatment other than supportive care for these folks, and obviously there's no cure. So when the infection takes hold in their lungs, in this elderly population, we can just make them comfortable. Realistically, a ventilator is not an option, unfortunately, for reasons the experts can lay into, but it's just heartbreaking.
And it is so prevalent in this nursing home. We've seen outbreaks, of course, in other parts of the country, in the lower mainland in BC, for instance, but it's so devastating there because the vulnerability of the patients, because there's no way to contain where people are. What's your assessment of why it has hit so hard?
Well, I think it's both. I mean, certainly they're the most vulnerable in our population. We knew this, as it was approaching our country, it's difficult to contain in these nursing homes. Where it's a family situation. This is a home. It's not set up as a hospital. We're not set up for isolation. To the extent that a hospital can offer. We do our best, but it just, once it gets into one of these buildings, it's difficult to contain.
Do you have the resources that you need at the nursing home? And I do understand it is supposed to be a residential, environment, so it's not necessarily a medical environment.
We're getting support. We're getting support from public health. I think one of the biggest problems is public health has been operating on a skeleton staff. Prior to this pandemic, I think we could do more from a public health standpoint to manage these sorts of outbreaks. We need to be anticipating this sort of thing. So I don't blame public health, certainly, but I do think we can do more in containment efforts than what we've been able to do.
And I understand many of the workers have also gotten sick. How is that affecting the capacity to help the older people in the home?
Well, for the first several days, it was very, very difficult. We had people not coming in for shifts and other staff staying for double shifts who are already exhausted. We're better now. Local organizations, province have stepped up and brought in some extra help from outside. But no, the home was overwhelmed. And that's another point. Our staff, our PSWs are stressed. We're stressed before the pandemic. Mm-hmm. They don't have enough time to provide care. I think they're underpaid significantly. And then you throw in a pandemic, and this just displays the weaknesses to this underfunded healthcare system that we're forced to work in.
What about, obviously there's no one coming in and out of the home, and that we've seen that sort of across the country, and people struggling to stay in touch with their family members. How are the residents that are there, even the ones who aren't sick, how are they managing being so isolated?
To be honest, I don't know. I can't imagine what it must be like for them. It must be frightening. They can't get their family in, they can't get the visitors in, the staff are run off their feet. We have family members outside their rooms through the windows, putting up pictures and waving and doing dances and the like, which gives them support. But it must be horrible for them, having to restrict visitors as we have been. But we have no choice.
You're an attending physician. You're a family physician. This is not the kind of work, I guess, that you would normally do. How are you doing? How are you coping with this?
Well, not getting a lot of sleep. It's some of these family conversations are just gut-wrenching. But I lay awake repeating in my mind, what these folks are going through and trying to support the families. I've been doing family medicine for 30 years and in nursing homes for all of that period. I've never had so many deaths in such a short period of time. We've been through influenza epidemics going through the homes and maybe lost a patient or two, but nothing like what we're seeing at Pine Crest. This is just unprecedented.
Can you tell me a little bit, without getting too deeply personal, about some of those gut-wrenching conversations, about how you even, start that conversation?
Well, I'll get ahead of the news then. I know one of my patients died this morning early. I spoke with the daughter yesterday, and granddaughter, pardon me, and had to explain, her mother was quite elderly, and we would provide supportive care, and we did. She was comfortable to the end, passed this morning. It's frustrating as a doctor. You want to do more, you want to help. I'm getting all these helpful emails and messages and Facebook messages from people. I had one this morning suggesting we use leeches. I've seen high-dose vitamin C, vitamin D. Donald Trump suggested hydroxychloroquine. I've had hot lemonade recommended. We don't have, as of yet, a proven and effective treatment for this disease. We certainly have lots we can do to support these patients and hope they can pull through on their own, but there is no antiviral as of yet that is effective. I take my lead from the experts. I'm just a family doctor.
So we would now be up to 13 deaths of residents in the home, from what you understand.
Well, I will leave the official number up to the end of the day. I just told you about mine just for illustration, but you can expect more deaths, so it will continue. This isn't going to stop.
Are you safe when you go in terms of your personal protective gear? Do you feel like you are equipped to go into the home?
Well, that's a good point. There is, as you're aware, a severe shortage, personal protective equipment. I was in the home the morning that we found out that the outbreak we were dealing with was COVID. I was immediately self-isolated. I did have some respiratory symptoms and was on quarantine until I got my negative result 5 days later. I've been advised since by our hospital and medical director and others that I should only go into the home if there's been emergencies. So I haven't been back into the home, but I have access to the patient's charts on my computer remotely. I speak with the nurses by phone. We are just offering palliative care, and we can certainly do that remotely. So no, I have not been in. I would like to be in. I really like to be at their bedsides. This breaks me up not being able to go in.
What worries you the most outside of this particular center in terms of the pandemic across the country? What worries you the most as a doctor?
I'm worried about the other 24 nursing homes in Bobcaygeon that have COVID in their home. The health unit's going to have to work extra hard to contain this and hope it doesn't get through their home. The best treatment for this virus is prevention, is avoidance. So yes, restrict visitors and contain this as best we can. Pinecrest is just an example of how bad it can be, how bad it can get. We need to learn from the example and contain this as best we can. I've heard recommendations to take family members home, out of facilities. If you can care for your family member at home, do so if the health unit allows them to get out. It's certainly a safer place for them than being confined.
Doctor, I know medical professionals never like to feel like they're doing heroic work, but it is times like this when you are. I can see that you're struggling through it, but I think it's so important for you to speak to people. So, thank you so much for doing that, sir.
Thank you.
All right, stay safe, stay healthy. Thank you. That's Dr. Stephen Oldridge. He's an attending physician at the Pinecrest Nursing Home in Bobcaygeon, Ontario, where he told us that as well as 12 deaths that had been reported, including a volunteer, he lost one of his patients overnight.